welcome. What I'm going to open with here is just a little bit of padding while we're just trying to encourage some other people into the room. So if anybody has a final talk in them, we're going to be talking about how we can use data and insight to, amongst other things, predict the next pandemic. So we'll be talking a little bit about Mehshr, which is the platform that enables clinical case discussion, and how we can use the data that we're creating to effectively map new outbreaks of infectious diseases, and how we're using AI and medical NLP and machine learning, amongst other techniques, to actually inform the projection and the modeling around the next pandemic. So if anybody has a final talk in them, come on in, and we will get started shortly. And hear about these wonderful things. I will also talk a little bit about Mehshr. I thought I would come at it with a slightly different angle, which is actually more of a commercial angle. So talking a bit about industry and how platforms that exist primarily to generate value for clinicians can also exist by creating value for industry as well, and what the intersection is there. And then we'll look at the more kind of innovative end of the insight spectrum at the end. Okay, so let's get cracking. So I wanted to start just by setting the scene in terms of market overview. You know, how are we looking at this in terms of a relatively high altitude? We've had a lot of interesting things today. I was just downstairs listening to some of the real-world evidence sessions around patients and their engagement, but I wanted to level set on HCP engagement, but also industry, and how those two areas kind of sit together. Tell you a little bit about Mehshr. So we're a platform designed for clinicians. I'm not sure if anybody in our huge audience right now is a clinician. If you could raise your hand. No? Okay, well, it's if you know any clinicians, we've got 1.8 million members currently globally in 190 markets. So we'll tell you a little bit more about that. And then we will talk about engagement and insight. So how are we using that platform to engage clinicians and generate insight? And then at the end, I'll also talk about some work that we're doing, which is being funded by a grant from Trinity College and MIT, but also in conversations with the UN about how we can leverage all the data that we're creating from those 1.8 million members and use that to actually map and inform the next pandemic. So setting the scene, I think we hear a lot about these things, but just at a kind of a macro level, you know, from a clinical perspective, it is almost impossible to genuinely manage and understand all of the treatments that are available now in terms of combinations and sequences of treatments. So clinicians are so overwhelmed. I mean, it's beyond burnout in terms of understanding that, and being asked more of them as well, so increasingly time poor. I think patients is a very interesting one. On the one hand, you know, you've got patients who are super engaged. Like I said, I was just downstairs at the real-world evidence track and was hearing about somebody from McKinsey who has a rare disease. He is personally collating, you know, 6 different data sets and combining those and then taking them to the healthcare team and the healthcare providers in an effort to have better care, because all of that data is so siloed. And I think on the other end of that spectrum, you have patients who are very engaged, but maybe aren't as well informed. So, you know, that Dr. Google aspect, and they are going to their clinician and asking questions, but they don't necessarily have, you know, the best information to hand. And then finally, and this is an area I wanted to dig into a little bit, is on the industry and company perspective. So COVID in particular, which we'll be coming back to naturally in this talk, is an area that has resulted in a lack of access. So companies that historically would have relationships with doctors where they're going in and either from a medical standpoint as an MSL or as a sales rep standpoint, they just don't have that access anymore. There's also this aspect that a lot of companies, whether it's smaller biotech or big pharma, are really kind of accelerating in terms of growth. So that's both in terms of M&A, but it's also in terms of the R&D that they're doing and within their own businesses. Can anybody hazard a guess at which company this represents on the slide here? It's a big pharma company. It has a French name. Any wild guesses out there? AstraZeneca is good. It's close. It's a little bit over the road, over the pond. It's Sanofi. But, you know, these are billion-dollar acquisitions that are being made in terms of the actual innovation that's being delivered. You know, 9 new molecular entities, 10 new indications, and 5 indications just for one product. So imagine if you're a clinician, even just making sense of that one product is, almost impossible. So what are we trying to do here? And that's what I said, putting it on a bit of a commercial lens to make a difference. So for clinicians, they're really looking for relevant information at the time of need. I have a question, I need an answer. Increasingly looking for trusted platforms versus branded advertising. That notion of the sales rep going in and selling to doctors is shifting away, either in terms of digital provision of information, but also medical budgets rather than promotional, which has a different implication in terms of the messaging, making it more patient-focused, and also just adapting to modern learning styles in terms of micro-learning and in terms of mobile first. Businesses, they need efficiency, and also they need that effectiveness. So how can we lower costs? And that sales rep is a significant channel there, but also maintain that customer satisfaction. How can we automate some of this kind of, we've built a great product, we've put it out into the market or are about to. How do we ensure that we're communicating effectively and meeting clinicians' needs around that? And how do we automate that? And then also, how do we accelerate the capabilities that we have that enable us to do that as well? So Mehshr itself as a platform exists to create value for clinicians and the clinical community, but we do have a commercial team, and that's my role in terms of partnerships and innovation at Mehshr. So I thought it'd be interesting to set it up from a commercial angle rather than kind of bringing that through at the end. But to talk a little bit about Mehshr, so we were launched in 2015 out of the Founders Factory, so a startup accelerator, a lot of workshopping, looking at this kind of core unmet need that exists, which is to share and discuss clinical cases and clinical information. It was launched with around 100 users. It was around 1,000 at the end of month one. It was 100,000 at the end of year one. We're now over 1.8 million members. That's over 190 countries around the world. So, huge traction and adoption in terms of that kind of core model. At its heart, it's really combining elements of social and that social context. So if you're an oncologist or a cardiologist, you can create and share a case. You can then post that and share that with other cardiologists or other GPs, and it enables you to do that. We're growing at more than 30,000 new members every month, and we've had endorsements from the likes of Tim Berners-Lee, which has been great as well. Excuse me. So what does that kind of experience look like? It's this kind of social construct. So you can see it's sort of a look and feel of a LinkedIn or an Instagram. As a doctor, you sign up, you scroll through, and you're served up relevant content. You can then follow cases, you can comment on cases, there are groups that you can join, but also you can create your own cases. So about 80 to 90% of the content on platform is user-generated. You can add photos and video, you can gain patient consent within the app. It's fully HIPAA compliant, GDPR compliant, and then you're able to share that out, as I was mentioning. So you can, if you're somebody working in diabetes, you could share that with other endocrinologists, or you could share that with cardiologists, and you have quite a lot of control there. And then we also enable the social networking aspect in terms of having your own profile and then being able to message other users as well. The breakdown of the audience that we can see, if we can just scroll up a little bit on the slide, please, is as you would expect, we've got a strong audience and reach in terms of the G5 and Europe, but also US. But we've done a lot of work in public health, in underserved areas, so low and middle income countries, which historically don't have a lot of educational infrastructure, and we've seen a lot of growth and benefit there. I think when you look at the commercial aspect, so that's delivering a lot of value to clinicians, clearly, that commercial aspect, if we come back to that same company earlier, and we actually map all of their different therapy areas that they're invested in, and then we say, okay, well, how many relevant stakeholders do we have that we can reach and engage through that audience or through the platform? It's obviously kind of quite compelling for industry. And as a result, we're partnering with 80% of the top 20 pharmaceutical companies right now and experiencing a lot of growth in terms of using the platform to inform and educate them as audiences. So talking a little bit about what we do then in terms of engagement and insight. So this is how we work with industry. And then I'm going to finish by talking a little bit about the data we're generating and how we can use that, again, from a more kind of utilitarian perspective. Two core aspects. One is on the left-hand side here, which is that targeting content and enabling that medical information, medical education, and learning. So we can create a group, for example, if we're partnering with Sanofi, let's say, we can then develop clinical cases that sit within that group in an educational manner, and we can then drive membership of that group. So if it's lung cancer, and we can drive membership of that group, which is oncologists with a specialty in lung cancer, and then we're providing them with information and patient cases that we know meet an educational need, so it's of value to the community. And we'll see that because of the comments and the engagement, but also when they're creating their own cases. But also we can see the value that's being created in terms of how that's growing and it's being naturally shared out as well. Excuse me. And then on the right-hand side, we have the clinical insight side of things. So once you run this activity, you can then mine that for data. So what are doctors, what are the oncologists in lung cancer really talking about in Northern Europe versus Southern Europe? You know, how are they really perceiving this therapy area or this treatment? And also, when we come onto it later, we're now using the broader mass of data, so over 1 billion data points on the platform, and we're using that to inform the predictive modeling that can generate insights, for example, to look at where the next pandemic might be coming from. A touch more just to kind of bring that to life and what those things look like. So on the educational side of things, why is this of value? Like, it's very much around that micro-learning model. It's very much asynchronous. So if you're a clinician who is looking to upskill in a certain area, it enables you to have rapid access and do that on your own time. I didn't go into this as much on the previous slide, but digital advisory boards. So this is more of a private forum. So again, where industry are launching a new product or they're looking for additional insights, then they are able to create a private group and have key opinion leaders join that group and then use that to inform their own insights. But fundamentally, you know, why is this of value? And why is this of value both to the clinical audience but also to an industry audience? And if you think about clinical practice and medical guidelines, guidelines and all of that published evidence really inform on what you should do, but they don't tell you how to apply that. So, you know, great, I know that the diabetes guidelines have recently changed and SGLT2 should be used at first line, but how do I really apply that when I have a patient that comes in, they're not overweight, but they've maybe got some heart disease, like what's the appropriate treatment? So if you create a patient-focused case, you know, that describes that patient, it describes their treatment history, then you can have that discussion around what that looks like and what that means. And often, especially in rare diseases where you have this loop of diagnosis and referral, and so somebody may be diagnosed even as a child, and they're misdiagnosed, they're put through lots of different treatments, and they're sent to different types of doctors. You can get stuck in that loop. So this kind of activity can educate a broader audience around how to identify for rare diseases, and then move people more quickly so patients are getting the treatment that they need, and they're also maintaining on that treatment as well. So what does that look like when we have partnered on an educational piece of activity? So this is in XLH, which is a rare disease. It's a bone disease, so it can cause rickets and soft bones. It manifests itself sometimes in childhood, but sometimes later in life as well. And often there is that kind of cycle in terms of misdiagnosis. So one of the key things that we really wanted to identify and then also focus on with the client was the percentage of doctors that were correctly identifying the diagnosis when we started that activity. And you can see it was very low, it was only 20%. Over the course of educational cases that are being delivered within a group to the relevant physicians, we're reaching 220,000 doctors. And over the course of a series of years, we've now moved that needle, so we now have almost 60% of HCPs making the correct diagnosis. So this has a huge benefit, obviously, for the patients who have this rare disease, but it also has a benefit for the companies that are creating the treatments and making sure that there is that correct diagnosis and referral often, and that's delivered. And you can see here this was delivered in a targeted way through markets in Europe, but also in the Middle East as well. And we were focusing on a broader general practice audience in terms of that earlier stage of diagnosis and ruling things out, but also to a specialty audience as well. We've also worked quite extensively with COVID, as you might expect, so a lot of cases being shared, especially when things were in lockdown and people were doing things more digitally. So within the COVID area, we took a very much early action to kind of identify and share out the cases that we were seeing. And that was spreading, gradually from China and Asia through to different markets around the world, and Italy and Europe, but also, Middle East. we identified that there was a specific need for targeted education in areas where the disease was likely to spread to next, and so focused area, and especially in areas of low and middle income countries. So there was focused activity there. We actually partnered with the Austrian Development Authority and also with Novartis, a pharmaceutical company, and we've engaged over 350,000 doctors and HCPs in terms of exposure to education around COVID. We also launched a web app, letsbeatcovid.net, which was gathering that symptomatic and behavioral data so it could be added into the NHS data pool. So this is an area where I think there was, that kind of real meeting of the moment where cases were being shared, and there was a need for education in a targeted way as the disease spread, and then we enabled that through some focused activity on Mehshr. So that gives you a sense in terms of the customer engagement, and like I say, looking at things maybe slightly more differently with a commercial lens, but also moving on to the clinical insights. So I'm going to start again from a commercial perspective, and then we'll come back to that notion of broader public health and public good and the utilitarian side of things. So this slide is intended if you are on the commercial side of a pharmaceutical or a biotech or a device business. Imagine what are the kind of the 5 key things that you would want to know before you launch a drug? So some of the elements on here, how does clinician behavior really vary by country? And, not in terms of a market research report or a broader quant study, but the actual interactions and discussions that are happening in relation to patient cases. Similarly, how are the clinical guidelines being applied? We know at a macro level that North America might deviate more strongly from guidelines in an oncological setting, but what does that look like in a more nuanced and in more of a micro view as well? And when you map that across the pathway, what kind of answers does it enable you to do, or what kind of areas does it enable you to focus in? So right from preclinical, there is the opportunity to identify areas of unmet need, but we're looking at real-world insight in terms of therapy area perceptions and product perceptions. We're then looking at how we can educate clinicians on appropriate use of treatments. And then as we move further forward, it's about that identification and referral. So in particular in rare diseases, how can we reduce that time and reduce that loop where there is misdiagnosis and those issues are occurring? And then finally looking at that kind of product perception and then new guidelines as the product moves into market as well. So the final thing I want to touch on here is looking at Mehshr Insights. So this is an evolving area of the business that we're working on currently, and where we have been using this and building a model out for pandemic prediction. So you can see essentially there's almost like a virtuous circle here with Mehshr, and hopefully you've got a sense of that from what I've just been explaining, is the kind of the content that gets created. So if we have an oncologist, let's say, they come onto the platform, they create an interesting patient case, they might invite their other oncologists onto that platform. You would have the discussion, the comments, we have polling, so there's voting around the cases as well. That all drives increased activity and engagement, and that in turn then drives those more members and partners. So we're working with over 200 clinical societies currently, but also we're seeing a lot of growth from peer-to-peer sharing and from doctors who are kind of sharing and inviting others to join that group. This obviously creates a huge amount of data, and we are using medical natural language processing, machine learning, and AI to essentially process all of that data and pull that through into insights that are of value. So I won't go into that in a huge amount of detail, but these are essentially prototypes of where we've taken our COVID data set, which is obviously a huge data set as you've just seen, and we're using that, and we're looking at co-occurring terms, for example, and we're looking at geography, and we're looking at incidence rate of occurrence. So if we're looking at an infectious disease and the spread of an infectious disease, where are we seeing terms that are co-occurring? They're escalating in terms of the volume and the rapidity of how they're being logged, and also geographically, where are those terms occurring? And we can use that to model and generate some very interesting insights. So there are a lot of applications for this, but I think one of the potent ones, and like I say, where we've received some funding, and if anybody in the audience or watching online would be interested, do get in touch, because we're looking for additional funding here. But that is to build out this model, because we see real potential and validity, not only in leveraging the billion-plus data points that exist on Mehshr, but also in ingesting data from other areas as well. So that hopefully gives you a sense of Mehshr, but also what we're doing in terms of COVID and how we are looking to disrupt insight and innovation. Thanks very much. Any? Sure. So we do a lot of partnerships work on more on the medical society side. So the technology and the technology stack is all built in-house. We make as much of it kind of open source as possible. We are continually looking at opportunities to partner in with other technologies, whether that is access to things like EHRs and that kind of data set. Interesting, I was just downstairs testing the HoloLens, and whilst everything at the moment on platform is asynchronous, I think there are opportunities for that, the case discussion aspect, but how can we bring other tools into that consideration set? So at the moment, the core technology is all built and owned by Mehshr. We have our own product and engineering team. But yes, absolutely looking at ways of how we can expanding that out. The one area where we are evolving that and can't publicly talk about it yet, but where we're doing some work around joint ventures is how we can ingest additional data sets, or how we can integrate tools that maybe historically were only available to industry in terms of access to insight, and how we can make those tools available through Mehshr. So if you're a doctor, you would normally have to pay thousands of pounds a month, let's say. These are normally multi-million pharmaceutical industry contracts. We're looking at ways of saying that through Mehshr, we can give you access to some of these technological tools and services, but it also enables us to obviously generate insight around what those behaviors are when those tools and services are being used. Any other questions? Sure.
So about the pandemic prediction project.
Yeah.
So what are the important parameters that you consider when building the model? Because you obviously need some parameters to predict what will happen next.
Yes. Yeah, absolutely. So, I mean, a lot of the work has gone into how can we what terms do we need to identify, and to what degree we can tag and ensure that those terms are appropriately ingested. We're also looking at different therapy areas, so looking at the COVID data set in particular, we can identify a huge number of different parameters and words that are being used in the context of clinical case discussion, and use those to model, excuse me. So if we identify those initial terms, and then we can look at the levels of co-occurrence and the incidence rate and the geographical variation. So we can then start to understand what the validity or what the insights that model might generate in that kind of more localized data set. And then we can look at expanding that out within the COVID data set, but also if we looked at another therapy area like oncology and all of the oncology discussions that have gone on, or even a subset of oncology or dermatology. So taking that approach of really kind of identifying what those specific terms, contexts of use are, and how does that generate insight that's of value. That answer the question? More or less? Excellent. Okay, well, thanks very much, everybody. Appreciate the time.